It's wonderful to have this opportunity and to be with the community today. Thank you for joining us. I wanted to take just a moment and mention Dr. David Gator, who was hard to say was a pioneer in spinal cord injury research and understanding. He was the head of the Miami Project. He recently passed away, which was a shock to all of us that knew him. A lovely man, so accomplished, just such a personality, just, above and beyond. And so we wish his family nothing but the best as they go through this very difficult time. It's a very, very sad thing that happened and such a shocking thing. Dr. Gator was one of those people that no matter who he met, he never met a stranger. And what a wonderful gift to have. He was just delightful to work with, delightful to be with, just everything about him. He was just wonderful in all aspects. So, I think that as a tribute to him, I think this month we should all do something in honor of Dr. Gator, and what that could be would be just to stop and say hello to somebody, check in on somebody, see how somebody's doing. Just, being that kind of person that is just interested in everybody and what they are. And I think that would be a real tribute to Dr. Gator. So hopefully people will take me up and just call somebody, pass somebody on the street and say, hi, how you doing today? Whatever you feel comfortable in doing. Just checking in on your friends, seeing what's going on. That would just be a wonderful tribute to such a wonderful man. Also, on a different note, I wanted to mention that the Reeves Summit is coming up in October. And so if you're interested in that, you can go to the Christopher and Dana Reeve Paralysis Foundation's webpage. And there's some information about the summit there. It'll be in Washington, D.C. It's October 13th through 14th. Now, if you think maybe you would like to go, but maybe expenses are an issue, there is a place on the opening page where you can scroll down, and there are some scholarships that are available if you might be having some financial difficulties in attending, but maybe you think you'd like to. It's always been just an exciting and thrilling program because it's about real life stuff in our communities. So it's just very interesting, a lot of proactive things, lots of things that are going along in the science, and lots of things about that going on in the community and how you can get more involved. And you meet other people as well, which is a lovely, lovely opportunity to meet and talk about things with people who are like, yeah, I get what you're talking about. So it's kind of a neat opportunity if you can get a chance to do that. Today's topic is about holistic and complementary care, or therapies. And I wrote a little bit about this earlier in the month. Some people are keenly interested in these kinds of things. And what more can I do? What are kind of some adjuncts therapies that I can add to my treatment plan to just make me feel better, or have a better outlook on life, or, connect better with my body rather than just, okay, I have to do this range of motion. Now I go do my bowel program, but kind of putting it all together in your mental well-being as well, kind of connecting it. And that's what holistic and complementary care therapies or treatments are about. It's holistic care is looking at the whole of the person. So it's looking at mind, body, and spirit and capturing all that. This is not new kinds of thinking. This is thinking that's been around for a while. As I said, some people really enjoy taking advantage of some of these therapies. Other people are kind of skeptical about it and they're not really interested. Some people go and I'm not really interested. I'm closed-minded. I'll sit here for one session and then I'm out of here. And you know what? That's okay. If it's not for you, it's not for you. There's other groups of people who think, well, I would kind of like to find out more about things. So they go maybe quizzical at first, but they get involved in it. And it really does seem to improve their health, but it depends on your mindset. It depends on just who you are as a person. So if you're interested in these, great, go ahead and try them and do them. If you're not interested in them, that's fine too. I'm going to talk about them just a little bit, and then we're going to move on to some very provocative questions that we have today. So in holistic care is things like looking at the body's energy. Now, if you have heard anything about Eastern medicine, they call it, from the Asian continent, the medicine is quite different from the Western medicine that we have here. They incorporate a lot of the mind, body, spirit into their medical treatments just naturally as their culture indicates. And so there's energy therapy, which is aligning the chakras in the body, which are these energy fields in the body that people do with these hand movements, not touching you, but with their hands closer to your body to help align that. And therapeutic touch, just, placing your hand on somebody where they can feel. A lot of people, will say, okay, well, they'll touch your hand or pat your hand, but if you don't have sensation in your hand, it's kind of like, why are you doing that? Why are you touching my body? It takes on a different meaning. So you need to find somebody who knows something about spinal cord injury when they're doing these therapies, so they can individualize it for your specific needs. Imagery is something that a lot of people use, but they don't know that they use it. I have used this myself. So when I was in graduate school working on my PhD, that is a tough course. That's tough to get through. It's a lot of new things. It's a lot of learning, and it's a lot of deep thinking. And I thought, oh boy, this is, it was exciting. It was challenging, but it was tough. And so I would sometimes think, I didn't know about imagery, but I would sometimes picture myself walking across that stage, picking up that graduate diploma. And that would kind of like, okay, yes, that's my goal. That's what I'm searching for. Now, my goal was to go out and expand my clinical arena and to grow as a healthcare practitioner. But my immediate look was to get that goal reached, get that degree. And so I would oftentimes picture myself in a cap and gown. What would it feel like to walk across that stage? What would it feel like to see my family sitting out there in the audience? What would the noises be like in there? How would this be? And I really found it quite comforting, actually. If it helped me or not reach my goal, I think it did. But if it helped me or not, I don't know. But it really made me feel better. So if you want to think about your future and what you want to accomplish or what you might want to do, that's a really neat technique to do, because it requires not too much, but your own thinking. Meditation to help calm your mind, to kind of bring your thoughts together. Life is so chaotic. Things are always happening. We're always running around. We're zooming from this place to that place, moving from meeting to meeting. Or maybe our life has taken a different turn and we're maybe not having enough activities that we would like to keep ourselves really occupied. So you can use meditation to kind of help calm what's going on in your mental awareness, kind of bring things together, give that moment to just kind of become at peace, and then those ideas in your subconscious kind of bubble up. So I have done this a couple of times, really using kind of more self-hypnosis. Just one day I was waiting to pick my daughter up from school, and I was there a little bit early because I don't know, I was coming from someplace else, and you know how you have that break, and well, if I go pick her up now, I'll be a little bit early, but if I go do something else, I'll be way too late. So you just go. And so I was just sitting in the car with the windows down. There was nice breeze blowing through, and there was this tree there, and the leaves were just kind of moving. And so I just focused on that, and that gave time for those subconscious thoughts to bring up, because my conscious mind was looking at those leaves and watching those. So those subconscious thoughts kind of came up, and it was just like, wow, I just gave myself a quick therapy treatment. It was really great. It really felt good. Another thing is to think about your senses and how they impact you. So with lights, I have a lot of light brights on because I'm on the video today. So there's a lot of bright lights in my face. So think about, lighting and what activity you're doing. Think about colors that you want to surround yourself with. You know, if you go to fast food restaurants, there's a lot of primary colors, especially red and yellow, because they kind of speed you up a little bit. So in the fast foods, they kind of get you thinking about eat more, eat more, eat more. If you want calming, it's the green and blues like you see in nature, the grass and the sky, that tree, that those leaves moving around. So think about that, how you surround yourself with what activity you're doing and what you want your environment to be like in that time. There's been some interesting studies that have come up in coma stimulation programs where people will play like a radio, or they'll have some music going, and so if the brain has any moment of awakening, there's something to stimulate it, as it goes on. And there's been a lot of work that's done about that. So people would put a radio in the room, they turn it on. Sometimes it would get out of tune, somebody bump it would get out of tune. So it'd be the static. And can you imagine just that gritchy noise going on? That would drive me crazy. So, thinking about what kind of things you like to listen to. We used to always say, well, play classical or tranquil music, but we find a lot of the kids today, they want rap. They like rap music. They can relate to rap music. That's what they listened to before. So they're switching kind of away from this real tranquil kind of almost hypnotic music of classical music into more rap, and like, what kind of music did this person enjoy listening to, and then tuning into that, and then turning it off at night so that the brain has their wake period and the rest period, so you don't confuse the brain that way. There's also complementary things that you can do to complement the treatment that you already have. All of these things are in addition to, they are in no way replacements. The holistic and the complementary are no way replacements for your medical care. You need to have that medical care as well. But some people get into acupuncture and they find that that is really restful and helpful for them. You want to go to somebody who knows what they're doing, especially if you have a spinal cord injury, because it involves needles around where your nerves are. So you want to be sure that somebody really knows what they're doing in your particular medical case. You might find somebody through your own healthcare professional. There are a lot of rehabilitation facilities that were kind of grousing around for a while, because they were saying, people are getting all these complementary medicines and they're coming in as guests, and then we walk in the room and they've got needles all over them, and what's going on. And so they said, well, if this is what people want and it's helping people, let's make it a part of our treatment plan. And so you could order, well, yes, I would want to have this. And they had people who are vetted and who know what they're doing, who are familiar with working with individuals with spinal cord injury or other neurological disorders. And so they said, let's just put it out in the open and let's just do it. There's nothing shameful about it. Why are we, why do we not accept these things? Art therapy is another thing that you might find in a lot of rehabilitation facilities, because it helps people bring out their thoughts and feelings. Tai Chi is something, and you can Google Tai Chi, which is the art of, it's actually an art of like a martial art, but it's done more now with very slow movement. If you see people in the park and they're doing their movements, their Tai Chi movements, and you can look online, you can see the Tai Chi movements and how to do it for people who use wheelchairs or alternative mobility devices. And I always find Tai Chi kind of funny, because I know very few people that start out with Tai Chi, and one of the first exercises is to rub your eyebrows very slowly and in a particular manner. And people who have sensation, 9 times out of 10 will have to stop the video because they have to go to the bathroom. They have to have a bowel movement. So sometimes I tell people, and they'll roll their eyes when they're doing their bowel program, if you do that Tai Chi exercise up here, sometimes it helps. Now, it may not help at all for you, but anyway, it's something that you can try. For some people, it actually works. Again, listening to music and then doing biofeedback to help relax the body. Or if you find you have one of those little things where you've been paralyzed, but now you can move your toe all of a sudden for no particular reason, we try to harness that movement and catapulted into other things. For some people, it comes in a finger. For some people, it's a toe. For other people, it comes in different ways. So we'll use biofeedback so they can sense how that nerve is working and look on the screen to visually see the movement of that nerve, the twitching of that nerve on the screen, so that they can harness that movement into other activities and maybe use it for something functional. So there's all different kinds of things, but as I say, be sure and check with your healthcare professional. There's nothing sneaky. There's nothing derogatory about trying something else if you want to help improve your state of well-being. There's nothing at all embarrassing about this at all. So just be sure and tell your healthcare professional so they can help direct you to a provider that's knowledgeable, and also so that they can help direct you in how you need to incorporate this into your regular healthcare activities. Now, there are other things that people do, and that's a lot of supplemental medications, a lot of herbs and over-the-counter kind of vitamins and supplements and all that sort of thing. If you decide that you want to do something like that, please, it's very important that you mention this to your healthcare professional. They can put that supplement in their computer. It'll come up with your medication profile that's prescription medication and can tell you if there's any interaction. So people do not realize that there are a lot of supplements and herbs that interact with their medicine. So just because you can go over to the store and buy this big bottle of a certain type of vitamin doesn't mean that you maybe even need to have that vitamin in your system, or doesn't mean that it won't alter some of your medication. So for instance, some people take vitamin K because they think it will help their blood, and it affects the blood. But if you're on an anticoagulant that's thinning your blood, the vitamin K will counteract that. Even in your diet, you know, if you take anticoagulants, they'll say don't eat green leafy vegetables because it has a lot of vitamin K in it. Now, most people get their vitamins and their supplements through their diet. So most people don't need vitamins and supplements, but if you are thinking about, you know, I think this would help me, be sure and talk to your healthcare professional. So vitamins A, D, E, and K usually get excreted out of your body, that just got washed through your urine. So if you don't need those vitamins, they're just going to wash through, and you're just really going to wash out that money you've spent on that vitamin. If you didn't need it, it's just going to come out of your body. The other vitamins build up in your body, so you have to be very careful. Like some people say, well, I'm worried about my bone density, so I better start taking some calcium pills. But you don't want to do that unless you need calcium, because vitamin C can and calcium can build up in your body. And so you can get too much of that. It can affect your heart. It can affect your movements, can upset your electrolytes. So just please ask your healthcare professional before you start taking any of these extra medications. And there's a lot of places online where you can see how these affect the body. But don't just look that up on your own. Go to your healthcare professional, your pharmacist. They have your medication profile. They can see what interacts. Your healthcare professional will say, well, yeah, taking vitamin C is not going to be the cure to your bone density problem. Maybe you need to do something else for your bone density issue, or maybe you don't have a problem with bone density, so that you shouldn't really be doing anything to upset the apple cart. So be very careful about those things that you do. Now, we have some very profound questions today. So the first question is that this is a person who has spinal cord injury and high blood pressure. Is X-Forge HCT good for spinal cord injury with high blood pressure? Now, I love this question because it is so loaded. So let's unpack it just a bit. So when we talk about blood pressure and spinal cord injury, and really a lot of other neurological diseases and injuries, brain injuries, what sometimes happens is the blood pressure naturally lowers over time. And so we're always talking about how the blood pressure goes down. And the reason why we're so concerned about that is because if the blood pressure spikes up, you're having an episode of autonomic dysreflexia, which is a huge medical emergency. So we always want people to follow along with their blood pressure, high or low. Just check your blood pressure periodically to see if it's slowly tapering off. There's some recent research that indicates that people's blood pressure, after it drops off, after a while, it starts to go back up to within non-spinal cord injury ranges. Now, some people don't ever have that effect, but we're finding more and more people do, but it's over the long term. So the question is their blood pressure going up into normal ranges because they're starting to become hypertensive or have high blood pressure as an issue unto itself, or is it just returning to normal? So these things have to be all ferreted out. But as I always say, you know, if you have a spinal cord injury, I figure that's enough. You shouldn't have to have anything else. Unfortunately, that's not the way it works. You can get any other healthcare issue if you have spinal cord injury or not. It's just, you know, it's the same for everybody. So some people do have hypertension or high blood pressure, even though they have a spinal cord injury, and they have to take antihypertensive medications. So in this case, it's not unusual. You have a spinal cord injury, oh, but they have hypertension. It's not AD, it's hypertension. And so they apparently have been recommended that this Exforge HCT, it's one of the newer blood pressure medications. So is it good for people who take spinal cord injury? Well, who have spinal cord injury? Well, that's one of those questions that is not generic as it sounds. The question should be, is it good for your hypertension with spinal cord injury? So if the answer for person A is not going to be the answer for person B, because we are all unique, we are all different. And so, you know, there's so many other factors that get taken into account for treating high blood pressure. If you have spinal cord injury or if you don't, there's hundreds, literally hundreds of high blood pressure medications. So I was checking into the X4 to HCT, and it's one of these new combination of blood pressure medication. So it's a combination of amlodipine, which is common blood pressure, generic, very cheap blood pressure medication. That's a calcium channel blocker. So again, it's that calcium, that electrolyte calcium that's regulating your body, and this blocks calcium from creating that high blood pressure in your cardiovascular system. So that's really very overly simplified. But again, if you would take this medication and you're taking extra calcium, you know, you're creating a conflict in your body. It is combined with this valsartan, which is another blood pressure medication, and that's an angiotensin receptor blocker. So that is blocking the high blood pressure, the system that's creating your blood pressure to go higher and higher. So again, very oversimplified. So it's a combination of these two medications. And it's a medication that's designed to treat essential hypertension. That's just generic hypertension that people get because their blood pressure has gone up. It's not the kind of hypertension you get in an autonomic dysreflexic episode. That's treated differently, usually with nitro paste or other kinds of different quicker acting. This is kind of a longer acting. So it will act for months, years, the whole time you're taking the medication, instead of that moment in time during the episode of AD. Okay, so complications of this medication can be dizziness. So you might notice, especially when you first start taking it, you might be back to that position where you where elevating yourself, sitting up in bed, transferring. You know, people would get a little bit dizzy because of their spinal cord injury. So they have to wear the elastic hose, maybe in an abdominal binder. So that might be recurring if you have gotten over that, or if you have it still, that autonomic hypotension, you might have more effects of that on this medication. Because of that, you get lightheaded. So you might feel lightheaded or dizzy. You might get a little bit of a headache when you have this. Now, some of the medication, this medication is basically okay for people kidneys. It's not to harm your kidneys. There are some rare incidences where it does harm your kidneys. And of course, we want to be very cautious about our kidneys. So what they recommend is that you have a yearly blood test that assesses your kidney function. So it's not going to, it's not a quick acting, it's going to be an overtime kind of thing. So you just want to keep that in the back of your head. And I'm sure your healthcare provider will be watching your kidney function anyway. What it can do is it can, in rare cases, so, we're talking about really rare cases, it can break down some of your muscle tissue, which then gets expelled through your kidney. So if your urine turns dark, suddenly you might want to call your healthcare professional right away. So, and it takes about 2 weeks for this to start lowering your blood pressure. It takes on average about 2 weeks for your blood pressure to get corrected into normal areas. It also might affect your blood sugar. And we know that blood glucose monitoring is something that we do with spinal cord injury because type 2 diabetes can be a complication of spinal cord injury. So you would want to have them monitor. It doesn't mean you have to go on the finger sticks or anything like that. If you are already diabetic, it can change your control, especially if you're on a drug called metformin, which a lot of people with type 2 diabetes take. It can interact with that. So again, here's your healthcare professional is probably looking at your medication record. You do not have kidney problems. You do not have diabetes. So you could go ahead and take this. Now, I'm not the person to say take it or don't take it. This is the discussion to have with your healthcare professional. But what I like to do is provide information so that you have those questions to ask your healthcare professional so that you don't go in, oh, okay, well, the doctor says I should take this, but I wonder. No, let's find out. This is exactly what I would like for people to do. Let's find out what would be the pros and cons of doing this. So that's it. So is it okay for you if your doctor recommended? I would assume they've checked any contraindications in your other healthcare issues, such as diabetes or your kidneys or any other medications that this might interact with. And so you could rest assured that that would be an okay medication for you. But if you want to ask them those specific questions, they should have no problem in addressing that for you and give you their reasoning why they think that this medication should be okay for you. Now, the complications, the kidney problems and the diabetes thing is so remote out there, but it does happen to some people. So if that bothers you, that even there's that infinitesimal chance that something could happen to you in that regard, then I would recommend you ask your doctor about that. Now, somebody has written in about, say more about blood tests for kidney functions. Well, for kidney function, they look at your BUN, which is a test of how much urea is in your urine. Well, it's all urea, but they're looking for how well your urine, your kidneys are functioning. One is the BUN, and creatinine clearance is another one, how you're clearing creatinine through your kidneys. If it's not clearing very well, there might be a kidney problem there. So those are two of the very basic ones. And so there are others that they might do if they suspect a certain problem with this, that, or the other thing. Another thing that they might look at is just your basic urine to look at if there's any blood in the urine. They will want to know where that's coming from. So it could be from a bladder infection, or it could be if you're having blood in the urine due to, they have to do follow-up tests and see if the blood is coming from your kidneys, because your kidneys shouldn't be bleeding. That could be from an infection, or it could be from urine backflowing up into the kidneys. The kidneys do not store urine. They only produce it, and then it goes down those two tubes, those ureters, down into the bladder. The bladder stores the urine and holds it until you're ready to get rid of it. The kidneys are only up here making urine, and then it comes right out stored into the bladder. So those are some of the very basic tests for just looking at your kidney function. But they will look at a lot more things as well. If they suspect there's any kind of kidney problems, they might do a kidney ultrasound, or they might do something called a KUB, which is a X-ray of the kidneys, ureter, and bladder, and look for if there's like a stone in the ureters or in the kidneys, because stone can make your kidneys bleed as well. So, you know, it kind of goes up the ladder as you go. They look first at the urine. That's fine. Okay, you're doing well. Then they'll move on up with to maybe some imaging studies, a flat plate, or maybe a scan, a CT or an MRI scan. Of course, urodynamics tells a lot about how kidneys are functioning and how the urinary system is functioning. Urodynamics is a test that if you have spinal cord injury, you should have done once a year to check your urinary system. Now, it's mostly the lower urinary system, not so much the kidneys, but it can still give you information about your kidneys. But if you have the urodynamic testing that tests the pressures in your bladder to make sure that the pressure is not so high in your bladder that the urine isn't shooting back up into your kidneys. Most of the time, if the pressure gets high in your bladder, it'll shoot out the urethra and you'll be incontinent. But if you have a lot of tone or spasticity in your body, and especially in your bladder, that urinary sphincter can be closed off very tightly. And so urine can't come out unless you do the catheterization or whatnot. So, how very professional, unless you have a suprapubic in or you're doing some other kind of toileting program. Maybe you have a Mitrofanoff procedure, which is a rerouting of, actually they most often use the appendix from the back of the belly button, the inside of the belly button, to the bladder so that you can catheterize through your navel. Because for some people, that's really hard to catheterize, especially if you're a woman and you're in a wheelchair and you have to catheterize during the day. You might not be able to spread your legs. You might not have the hand function to do that catheterization. So a lot of women will do this. It started out as a procedure in pediatrics, if you can believe that, because little kids and keeping sterile and doing all that you have to do with the catheterization through the urethra is very difficult. So they started out by doing that procedure with children, but adults are like, hey, this would work out fine with me. Some men, for a variety of reasons, they also get it. Some men have a retracted penis and they can't get to the area. Like women, you just can't get to the area. And so a lot of people will elect to do that. It is a surgical procedure. And, you know, I always guard against those. I'm not opposed to surgical procedures in any way, shape, or form, but there's always something you really want to think about because of the risk and benefits of having surgery. You always want to weigh that. So there's all different kinds of things, but basically looking at that urinalysis and looking at your creatinine and your BUN, those are the ones that they're basically going to look at. So I hope I answered that for you. The next question is a discussion about skin integrity at pressure points. And this person understands pressure relief, but they're looking for a holistic routine, any topical routines, anything that can help prevent a pressure injury. And so there's a lot of talk about this. People are always looking for something because the treatment is kind of tedious. Pressure releases, sitting on pressure dispersing equipment, so medical grade equipment. If you sit on a pillow and you have a bony prominence in what they call the sitting bones or your ischia off your pelvic bone, there are two bones that when you're sitting, they are going right down into your where you sit. They press on the skin right where you sit. So you have the whole pressure of your body going right down there onto that particular area. Unless you do those pressure releases and let that pressure, that blood flow back through that area. So if you sit on a pillow and you are sitting on that, pillows collapse. They don't disperse the pressure. A pillow, when you feel it, is soft, but when you're putting your weight on it, even the weight of your arm, it's going to just collapse and not disperse that pressure around, not let the blood flow around that area. You still have to do the pressure releases because there is nothing that can prevent a pressure injury except doing the pressure releases to get the blood flow back going in that direction where it needs to go. So anyway, this person was asking about holistic things. So envisioning that you don't have a pressure injury is probably not going to cut it. Envisioning a time when you don't have a pressure injury will help your mental well-being, that I'm going to get over this is going to happen, I'm going to heal this pressure injury, or I'm going to do everything I can do to not get this. But you got to relieve that pressure to make sure that blood is flowing significantly. But there are some things, and there's a lot of things that people, the question went on to ask about, he had heard about vitamin C and zinc. If you put that into your diet more, that you'll have less chance of pressure injury. Now, there's not really any evidence to show that that's going to reduce your risk of pressure injury. Again, unfortunately, as I say, it's the pressure releases. You have to turn at night. You know, some people think, oh, I'm on my pressure cushion, I don't need to do anything. Yes, you still do. Even though you're on that cushion, you still do. So unfortunately, that's just the way it is for right now. But, you know, we'll see that in the future, we've got a lot of things coming out on board that, you know, is going to help take care of some of these issues in a very positive way. So we just need to hang on a bit. So, so treatment specifically with the vitamin C and zinc. I did find one study, and I have some notes over here, so I'm going to look over here. This was a study done by a woman by the name of Catherine Deneuve, and I'm going to spell it. It's Desneves. It's in the Journal of Clinical Nutrition in 2005. And this this study was done, reported in 2005. It's a treatment of people who already have pressure injury to see if their wounds would heal faster using arginine, vitamin C, and zinc. So 3 things. And they'd had 16 patients, so it's a very, very small study. It's not been replicated that I could find. And these patients had wounds at stage 2, 3, and 4. So they had open areas in their wound. They gave some of the patients a standard diet with a protein supplement, and they gave them the arginine, vitamin C, and zinc supplements. And then the other group, they just gave the regular diet and the protein supplement. And then they measured using a standard assessment measurement scale of pressure injuries. And they found that the group that all these people already had pressure injury. And they found that the group that had, that took the 3 supplements did have quicker healing of their wounds. But again, this is a very, very small study. Now, in 2009, a man by the name of Joseph, middle initials MGA, 3 middle initials, Scholes, SCHOLS, in the Journal of Tissue Viability in 2009, did a study to see if this mixture would help prevent pressure injury, and they found no significant changes in that. So that's what we know about these. Now, there's a lot of products that are available online that are promoted for preventing and healing pressure injuries. You have to remember that when you rub something on your body over pressure area, you're putting pressure on the pressure area. So it's not just sitting. It can be, you know, massaging an area. Sometimes people go in for those deep massages. That's putting pressure over your pressure areas. So, you know, you might want to think about that. Sometimes people will see a red spot. I hate to even mention it because it used to be, but years ago, they would say, oh, you have to rub that and get the body circulating that blood. No, you're just adding more pressure. So you don't really do anything to those pressure areas. You want to keep the blood circulating there, not be, you know, rubbing or massaging them in any way. It's very important. So there are a bunch of products that are available. Some people in the community have ordered some of these products and they swear by them. Now, I'm not recommending any products whatsoever, but I have heard from a few people in the community about this product called Noop, N-O-O-P. I am not recommending it because I don't recommend products, but there are some people who find that seems to help them prevent pressure areas. They just use the little dab, put a little dab on a certain spot with their finger. If you have diarrhea, you can get a pressure area, or if you get incontinent of urine, that can break down your skin. Sometimes men have trouble with spouses who use the external or condom catheter because the urine is being held up against the outer skin of the penis. And so there's a thing called skin prep that you can put on that area, or if you have diarrhea, you can put the skin prep. It looks like a little 2x2. It looks like a little alcohol pad, but it's not alcohol. It's skin prep, and it leaves a very fine film over the area so that any kind of corrosive material like urine or liquid stool or any stool, so that it won't eat away the skin. So that's an important thing to think about. There are other products. Quest has a product for skincare. There's a lot of different preparations that people use. But there again, if you're rubbing any kind of lotion on there, you want to be careful on how you're rubbing that lotion on there, because it's those small capillaries right under the skin that tend to break down first if they're not getting enough blood pressure through there to pump the blood, because that bone is poked down on the skin. So that's an issue with that. So is there anything, if there was something that was out there that was like, oh, this is the thing that works, I would tell you. So a lot of people do some trial and error, but you really want to think about what you're putting on your body. Check with your healthcare professional, make sure that it's not contradicting anything. People think, oh, I'm just putting on hand lotion, but that can cause issues as well. So just walk it through the normal procedures of checking to make sure that everything is in the right way you want it to go. Okay, can you explain ASIA levels and do they ever change? Well, the ASIA level is a system of assessing spinal cord injury. It's a very, very good system. It's been used in the United States for years. In Europe, they use the Frankel system. They're very similar. There's a few wording differences. But the ASIA system has been created by spinal cord injury professionals in the United States, been used for years. So the ASIA A means there is a complete injury. Now, this is one of the big things with the ASIA scales, because healthcare professionals will get this mixed up, as well as people who have spinal cord injury. They'll see the word complete and they'll transfer that definition to being, I completely severed my spinal cord. No, you didn't. Hardly anybody ever severs their spinal cord unless there's a knife or a bullet that pierces right through the whole thing. There's always some fibers left. The spinal cord is under tension in your spinal canal. So if it's severed, it would shoot up and pull on the muscles out from where it's connecting out into the body. So it's very, very rare that somebody has a completely severed cord. So rare, in fact, that we just say it just next to never happens. But the word complete confuses people. It means complete injury, not complete severing. So first of all, if you have a complete injury, I have people all the time, my spinal cord is completely cut. And I'm just like, no, it's not. It's not. You have a complete injury. And what that means is you have no motor or sensory function below the level of injury. And they do this by doing the digital rectal exam and assessing S4 and S5. So that's the way that goes. So there's complete injury means a complete injury, no motor or sensory below the level of injury. Now, B, C, and D are incomplete injuries. That means there's something getting through the spinal cord. So it's not a complete injury, it's incomplete. Still has some things going on. And actually, the complete still have some things going on too, but it's not translatable into an assessment. But B, they have a sensory but no motor. They might have some sensation at S4 and 5. C is some motor function, but nothing against gravity. And so half of the muscles, you can move your arm maybe without gravity present, from side to side, but you can't move it up and down. So some motor function, but half the muscles are below grade 3. And D is some motor function, but there's muscles more than half are above grade 3. So there is some movement against gravity. And then E is motor and sensory function have returned to their baseline. So they've returned back to usual function. And so how does somebody get to be an E? Well, sometimes people, like you might see people on the football field and they get what they call a stinger and they become completely paralyzed, but it's like a shock to the spinal cord and the spinal cord recovers from it. They can then become a motor E. So they still have a spinal cord injury. They still have, issues with wanting to protect that spinal cord because you don't want to get a second one, but they have now become a motor E. So does sensation ever change based on the ASIA scale? Well, yes and no. So after spinal shock, which might not resolve for after 6 months, you might find your ASIA level improves. Because of the spinal shock, the whole spine is like in shock is what exactly it is. So you might find as that resolves, you might get more function. And so that can take from 6 weeks to 8 months. So after spinal shock, you usually see a change in the ASIA. You may or may not. If you have a head injury in addition to a spinal cord injury, as the head injury clears, you might see improvement in your ASIA score, because sometimes the head injury is masking your function because the brain's not producing the message. It's not that the message isn't getting through, it's that the brain's not producing the message. And so it's read as the message isn't getting through. So of course your ASIA score can improve. If you have swelling in your spinal cord, which you do after spinal cord injury, and the swelling goes down, you might see an improvement, maybe like a level or something at that time. Now, the opposite, should the ASIA scale become worse? Should you go down in the ASIA scale? That shouldn't happen. And you should get an appointment with your doctor, because you might have something called a syrinx. Sometimes people get a cyst in the area of their spinal cord injury, and it starts getting bigger, and it presses against the nerves that are working. And so there's surgery that can be done to correct that so that you don't lose more function. Now, with all that being said, with the new technology that's out there, with the electrical stimulation that's going on, people are finding that they're increasing their function. Well, that's great. But also they're finding that they're increasing their function when the stimulator's turned off. So there's a thing called this hangover. And they use the stimulator, and maybe they're moving their arms and doing some activities. Maybe they're using their legs. Bowel and bladder function is improving. And suddenly they find that those pathways that we're always searching for, the nervous system is very plastic. It's always searching for a new pathway. Well, the electrical stimulation maybe has taught the nervous system a new pathway, and people are suddenly able to recognize, hey, I have a sensation. It's not like the sensation I had before, but I have a sensation that alerts me that I need to urinate. And so they're either able to go cath, or they're able to Some people are able to urinate for different reasons using different techniques. Anyway, they're starting to learn how to read some of the signals of the creation of these new pathways. Now, all of this is new. So we're just learning about this now. So I really can't say, oh, this is the future. I can't say, oh, if you do this nerve stimulation, this is what's going to happen. I can say that so far in a few people, this is happening. So we have to see how all of this is going to play out in the future. So will changes in this Asia scale happen in the future? I would like to believe so. But again, that's just using my personal opinion about things. Here's a question that somebody has written in, so let's get to that. I'm a C5-6 quad. How long should it take for a bowel program to last? We use magic bullets and the bowel program still takes 5 to 6 hours. Can you suggest anything that won't take all day? Yes. Oh, the information specialist would like to say something. Or maybe not. Okay, I don't know what that little signal means there. But yes, there are things that you can do. First of all, at C5-6, quite often, what is happening is that you probably maybe have some tone or spasticity. So first of all, look at how you're doing your bowel program. And I apologize to our writer of the question. I don't mean to be saying this is you. I speak in generalities for everyone. So you might be saying, oh, I've already done that. Move on to something else. But I speak in generalities. So at the cervical and thoracic areas, there's a lot of tone in the body. Tone is what we now call spasticity. That's the new word. So sometimes people want to get in and get out as quickly as they can. And so something that you might want to try is be sure and for everyone, insert this suppository very gently. Use a well-lubricated gloved finger. Be sure the suppository is up against the bowel wall. If you insert it into stool, it will not dissolve. So be sure it's up against the bowel wall. And then do your digital stimulation. And again, very slowly. Because you want to relax the sphincter. The faster you do it, the more tone you're creating. So you want to do it very slowly. Okay, so say you've done all that. Of course, look at your diet. Make sure you're drinking enough fluid. All those kinds of things. Move your legs periodically throughout the day or have someone move them for you because those muscles will stimulate the abdominal muscles. So that will help. If you are finding that the magic bullet is not working for you, you can take the next step up and try one of the mini enemas. There's 2 on the market. I know that the enemies stimulates the nerves that are in the bowel. Again, it's a mini enema. It's only a tablespoon or a teaspoon. It's only a teaspoon of fluid that goes into the bowel, but it has to be up against the bowel wall. It can't go in the middle of a stool. You might have to take out stool first before you begin your bowel program. Because if that stool's in the way, and you still get the suppository up against the bowel wall, it's not surrounding the whole bowel wall. So you might need, if there's stool present, you might need to take that out. But you can try one of these mini enemas. People seem to like those. You can try adding Miralax or Senna as an oral stimulant to the bowel because those are asthmatic. So they add water to the bowel, which helps the stool pass along more easily. So those are just some ideas to get started, to just try to think about what kinds of things, but you might be ready for the next step. Now, there are some other things that you can do. There's this lower bowel water enema thing, and I want to call it the Pristine system. Some people like it, some people don't. It's a very divided group, but they will help you with that. You don't want to use a full-fledged enema because those flush out the bowel. and they just tend, so they don't allow the bowel to work in its natural function. We want to stimulate that bowel to work in its natural function, because this is one of those cases, if you don't use it, you lose it. So some people get off enemas. They've been using enemas for years. They stop working after a while. And so they want to get off their enemas, and they do it. But some people have a really hard time getting changing off to an enema program. And it's not helping your bowel at all. It's not helping your bowel program at all. So, you know, this is why we try to stick with these real simpler programs. Now, again, speaking in generalities, and for the writer of this question, please don't leap into this answer. Some people elect to have a colonoscopy, and it's an elective procedure. Some people, you know, say that that's really going to be the end all be all. And for some people, it has been. For a number of other people, it's been worse. And they then have to go back and have surgery and have it closed, and, you know, try to get the bowel rerouted to doing what it should be doing. So this is not a light decision to make. Now, I've talked to people that they've had it, and I think, why wouldn't everybody want one of these? Well, there's some problems with it. Number one, if you look at the ads for the colonoscopy, or for the colostomy, you know, you have to wear a bag that collects the stool. A lot of people are embarrassed about somebody doing the bowel program for them, or they don't want their spouse to do it or whatever. Usually the person says, no, I don't mind doing that. This is what needs to be done. You know, it's not like the highlight of my day, but I don't mind doing it. And so they jump into the colostomy decision. But if you look at the ads for the colostomy bags, you'll see what you'll be wearing. A part of the bowel is brought out to the outer part of the skin, so that can get, the skin can get some redness and some roughage around there that can lead to skin problems. But you put the bag on. If you look at the ads, you'll see everybody in the ads has a six-pack. They have a good abdominal structure in there. People with spinal cord injury generally don't have a six-pack. In fact, not too many people do. So the bag blows off, the bag falls off. They're out in public, and all of a sudden their bag has escaped, or they've passed a lot of gas and it's blown up the bag, and the bag now is filled with gas. And anyway, I'm not saying don't do the colostomy. I'm not saying do the colostomy. I'm just saying know all the risks and the pros and cons before you think about doing a colostomy. But that's usually the way things progress. Now, some people will elect because it's an elective colostomy. Some people will have it in the lower abdomen, closer to where actual stool is formed. Some people will elect to have it higher up in the bowel, so that's more of a liquid stool that comes out. So there's all kinds of different options for that. But for this writer who's writing in, it takes their bowel program 5 to 6 hours. Those are just some of the things that you can think about if you can, if you're not on a bladder program with water restrictions. Try to increase your fluids just a little bit. A little bit does good. Don't sit down and say, okay, I'm going to drink a big glass of water every hour because that'll increase my fluid, because that overwhelms your heart. You know, you got to think about the rest of your body parts too. So just take an extra couple of sips if you're not restricted in any other way. Add the Senna or the Miralax. Again, talk to your healthcare professional to make sure that is what you need to do. And then take out stools in there before you use the magic bullet. And then gentle insertion and very gentle stimulation. That's going to be critical. Now, there was another question here that somebody wanted to know the name of the drug that was discussed for high blood pressure. It's called Exforge HCT, EXFORGE HCT. But again, that's just one of the many, many, many blood pressure medications that are on the market. So, you know, just because something is good for one doesn't mean it's good for everybody. So I think I have answered all your questions. Yeah, I was just double checking the list there. So, and it's the top of the hour. So I guess that worked out perfectly. Anyway, I wish you well this next month. Be cautious. Remember, the COVID is still out there. So people are entering society, and that's great. Just be sure and, use cautious, especially if you have concerns about it. Be sure and wash your hands. Be sure anybody that's touching you is washing their hands. Try to maintain your distance. Wear a mask if you feel like you want to wear a mask. I wear my mask when I go out. People who have spinal cord injury and neurological injuries do have some immunocompromise. Some people, the immune system's working just really well. For other people, it's, more of a challenge. If you have a lot of like bladder infections and, you just have a lot of maybe colds or coughs or that just more than you did say before your injury, you might have a problem with that immune system. So there's no way to say, oh, you can't look at somebody and say, yes, you have a problem with that. You don't. But those are some clues that might lead you to the thinking that maybe there's a problem with my immune system. So anyway, here, there's one more thing. Somebody had an ostomy and it changed their and their family's life for the better. Don't have a six-pack, have more of a beer keg. I love that. I'm going to steal that. And the bag works well with loose clothing. So, as I say, there are lots of people who have colostomy or urostomies or any kind of ostomies, and they just love it. So they said they wrote in, oh, is there going to be a talk about SCI and bowel care? Well, there certainly can be, because there is a lot to say on that. You can also go on to the Christopher and Dana Reeve Paralysis websites. You can find the blogs that are written about that goes into a lot of detail. And there's also a bowel care booklet that you can download. And of course, all these things are free. You can just download them right off the website. So I'm sorry I didn't see that question until now, but we can arrange to talk more about SCI and bowel care, because that is such an issue. And I do appreciate that question as well. So for now, I'll say thank you. I hope you have a wonderful month. Be cautious, be careful, and stay safe. Thanks for joining us today.